I'm Dr. Michael Fisch. I'm the editor of the Journal of Supportive Oncology, and I'm a medical oncologist at the University of Texas MD Anderson Cancer Center. And I'm here with Tony Bach, who's a medical oncologist at the University of Washington in Seattle. Tony, your expertise is in communication, and we appreciated the remarks that you made today. One question I have for you has to do with relating your work to some of the things that Susan Block has been doing. And she talked about the value proposition in healthcare and where strides in communication could really perhaps make the biggest dent in that regard.
Yeah. Thank you. And I thank you for those kind remarks. You know, Susan and her colleagues at Partners in Boston are doing this huge, fascinating, I think, visionary project about the value proposition and about using communication as one of the major chunks of things that produce value. And it makes a lot of sense to me because, you know, we know that there's this huge expenditure of cost near the end of life for patients with advanced cancer. You know, as we look at it as, you know, clinicians, and then as economists, the question is, you know, are we really getting what we pay for? And what should we be doing? What's really the best use of resources for those patients? When we know that, you know, many patients, if we could match their values to their treatment choices better, it would turn out a little different. And, you know, maybe the percentage of patients who get chemotherapy within the last 2 weeks of life, you know, might be different. And so I think that's what they're looking at, and they're looking at a communication intervention to see if that will change that.
So aren't our communication patterns pretty well ingrained from fellowship training and then our years in practice? So can you teach old dogs new tricks in this regard? Well,
they're ingrained, but they're not immutable. So I think what we've learned and what lots of other investigators have shown is, given the right kind of learning situation, you know, physicians can change. And I think there are a lot of physicians who feel frustrated by what currently happens in their practice but aren't sure how they could do better. And so that's where I think there are some new things that are just about to happen that will make some venues of real improvement more obvious. Like you know, the clear one is, you know, we teach a lot of communication with lectures, and of course it turns out that doesn't really change people's behavior. What you really need to change behavior is feedback on your performance. Right, someone listens to you and says, hey, when you said X, the patient said Y, and, you know, there are other ways to handle that. That's the kind of learning system we need. And that's what's starting to happen. You know, James Tulsky, you know, our colleague at Duke, he has a paper coming out in the Annals of Internal Medicine in just a couple of weeks that shows that customized feedback on audio recordings of patients talking to their oncologists actually can be part of an intervention that improves the amount of empathic response that an oncologist does. These are oncologists at Duke and University of Pittsburgh. Yeah, and it's very exciting. So I think there's some things like that that are going to hopefully make this much more accessible than it's been in the past.
Well, that's fantastic. Tony, thank you.
Thank you.
Well, stay tuned because there's a lot more to come from the Chicago Supportive Oncology Conference tomorrow.